Colonoscopy is a medical procedure used for both diagnostic and screening purposes, including colorectal cancer screening. The diagnostic purpose is to investigate symptoms like abdominal pain, rectal bleeding, or changes in the bowel habit. Screening purposes is to detect and prevent colorectal cancer by identifying and removing the precancerous polyps. Now let's talk about the most important part about the indication for the screening. In general population, the usual colonoscopy screening should start at age of 50 years and should repeat every 10 years. If there is a single family member history of the colon cancer, it should be started at the age of 40 or 10 years earlier at the time of the family member's age that was diagnosed with the cancer, whichever comes the earlier, and then follow up every 5 years if the family member was diagnosed at the age of less than 60 years, or if it is greater than 60 years, you need to follow up every 10 years. If there is a 3-member history of HNPCC, also known as hereditary non-polyposis colon cancer syndrome, you should start the colonoscopy at the age of 25 years and then follow every 1 to 2 years. And if there is history of familial adenomatous polyposis, there are thousands of polyps, you need to do sigmoidoscopy at the age 12 years and repeat after every year. If there is previous edematous polyp, you need to repeat colonoscopy every 3 to 5 years. If there is history of previous colon cancer, you need to do colonoscopy 1 year after the resection and then follow after 3 years and then every 5 years. Now let's talk about some complications. The risk includes bleeding, perforation, or adverse reaction to sedation. Infections is rare but possible. The patients are monitored until sedation weans off, and normal activity can usually be resumed the next day the post procedure. The normal finding indicates a healthy colon. Abnormal may include inflammation, polyps, or signs of colorectal cancer. Further investigation or surveillance may be recommended based on the findings. For polyps, a surveillance colonoscopy schedule is often established as talked above. The understanding the indications of colonoscopy in screening and diagnosis and recognize the importance of proper patient preparation and potential complications are very important part of the USMLE resource for the update and changes in the guidelines. Thank you.